Pulmonary tuberculosis is an infection of the lungs caused by a bacteria called Mycobacterium tuberculosis. Today, I would like to talk about the chest X-ray and lung auscultation of a patient who have a history of pulmonary tuberculosis. So, the patient's past history first infection due to the Mycobacterium tuberculosis is called primary tuberculosis. It is shown in the chest X-ray that there is a complex called Ghon complex, which consists of a Ghon focus along with pulmonary lymphadenopathy within a nearby pulmonary lymph node. Then, the primary tuberculosis can either heal, become latent, or become progressive. So, the healed tuberculosis chest X-ray will contain scars at the previously lesioned site. If primary tuberculosis becomes latent, it has the chance to turn into secondary pulmonary tuberculosis due to the reactivation of the bacteria or secondary infection. Through the chest X-ray, cavitation and consolidation of the lungs and scars can be seen usually at the apex of upper lobes in the lungs. Usually in an elderly patient or immunocompromised patient, primary tuberculosis will go into a progressive state. Through the chest X-ray of progressive tuberculosis, the lesion is shown to be poorly walled off by fibrous tissue, but cavitation is rare. If progressive pulmonary tuberculosis and secondary tuberculosis continue to progress, then miliary tuberculosis will be formed. The chest X-ray of miliary tuberculosis will show millet seed-like pattern due to the formation of yellow-white consolidation through the lung parenchyma. For the lung auscultation, patients with pulmonary tuberculosis will often present with bronchial breath sounds, which sounds like this. And also coarse crackle sound, which sounds like this. So, this is a summary on the progression of pulmonary tuberculosis. That's all from me. Thank you for listening.